Hello and welcome back on the Midday Update. Now in this story, according to Professor Dr. Lee Chi Peng, the CEO of the MS New Symphony Exercise Clinic, more than 70% of COVID-19 death cases in Malaysia had comorbidities of non-communicable diseases or NCDs, and said an exercise medicine expert, Professor Dr. Lee Chi Peng, what he's simply implying and saying is the risk of contracting COVID-19 is higher in people with weak immune defenses and could further be compromised in chronic conditions such as the heart and lung disease as well as diabetes. Professor Lee joins us via phone call to walk us through exercise medicine. Hello and welcome, Professor Lee. Thanks for joining us.
Hi, Elaine. Thank you very much for inviting.
Thank you for coming in to talk about exercise medicine. Now, on to my first question. What is exercise medicine, Professor?
Well, exercise medicine is actually a prescription of exercise that people should exercise with a dosage. You see, a lot of people have been complaining that exercise doesn't work for them because the dosage is not there. So to have an exercise program, there should be a dosage. So that's why with the dosage, we have actually founded exercise medicine.
I see. So I think a lot of people perhaps have don't have the correct prescription then for the exercise medicine. Now, where can one study exercise medicine?
We have actually developed and started up a college called the Asia College of Exercise and Sports Medicine. This college is based in Kuala Lumpur, City Alam, and we take in Form 5 students after the SPM and train them to be exercise therapists. And these therapists are the people who actually assess patients referred by doctors, who have non-communicable diseases, and we will treat them with exercise correctly with a dosage. So the college is the only one in the country, and this is where they can study.
So, Professor, how do you make sure that you have the necessary study qualifications to go into the college to study exercise and sports medicine? Are there criteria for entry?
Any Form 5 students who have passed the SPM with the science credit in science and physically active, they are allowed to enroll into the college. This college actually focuses a lot of practical, how to teach them how to do diagnosis and health screening and assessment. And then we will use the software to assist them to prescribe exercise program with dosage for individual non-communicable diseases like high blood pressure, diabetes, and some heart problems and so forth.
So how is this? Sorry, Professor, continue.
Yeah, basically it's the non-communicable diseases. A lot of these patients, they have all these diseases and they do not know how to exercise. So what we do here at the exercise clinic, where we have set up our self-exercise, we have about 8 exercise clinics here. And these 8 exercise clinics, we receive a lot of referrals from medical doctors who wish to tell their patients to exercise as a first line of treatment before they administer pharmacological medicine.
Right, Professor, can you quickly perhaps tell us what is the main difference? A lot of people think that they are already exercising. They perhaps go for walks or join a gym or already do some typical exercise out there. So what are they doing wrong versus what exercise medicine prescribes for?
That's a good question, because actually exercise is very important. It is a very simple word, but it has been misinterpreted all across the world, because exercise has to be looking at the prescription to get the effect. Now, the difference between exercise medicine and the normal conventional exercise that people do, we call them recreational. It means they do it just for because they know exercise is good. They go for walks, they go to the gym, they do aerobic dancing and swimming and so, which is good, which is a kind of movement. But if you want to see the good results and effective results, being your time dedicated into this exercise time, so you should do it with the proper dosage. That means if you want to do aerobic activities to improve your heart, we should do a prescription to count and calculate what's the dosage, how many heartbeats you should achieve depending on your physical fitness status and your health status today. And if you want to do resistance training, lifting weights, we also must have a prescription. Because right now, a lot of people going to the gym, they just lift the amount of weights that has been told them to do. And most of them, they will end up with pain here and there. And then this kind of delay onset of muscle soreness will actually prevent them from going back because it's too painful. The dosage is not correct. So this is the vast difference here.
Right, Professor. I think people perhaps may not necessarily see the good effects of proper exercise versus the physical results that people actually try to achieve for exercise. Now, let's talk about students who actually study at the age of college. Where do graduated students work after completion of their studies?
Well, right now we have set up exercise clinics. And all these students graduate, they were immediately placed into our exercise clinic to do their job, you know. And some of them have been hired into fitness centers to look into the preliminary establishment of trying to get some form of exercise that is effective. And these students were actually, all our students are being employed, mostly to fitness centers and all our exercise clinics.
Now, Professor, we are now still in a sort of paraphrase. We are no longer MCO, but we are CMCO, which means that a lot of people are still not fully able to freely move around. What are your thoughts on what's currently happening? How can people manage this, especially with exercise?
Well, it is very important that exercise should go on. Before MCO, I'm sure there's a lot of people who have been exercising and reached a certain fitness level. But since MCO, you know, all those that have invested in the time in exercises would have diminished, you know. So I think what we have actually done in the college and also from the exercise clinics, we have developed a lot of home-based exercise that we have posted in the medias, and we have a lot of feedback and, you know, calling us how to do it. So we actually assist them doing home-based exercise right now instead of just, you know, not doing anything.
All right, thank you so much, Dr. Lee, for telling us a little bit more about exercise medicine, as well as sort of dispelling some myths about just exercising doesn't necessarily bring you the benefits that you're looking for. Thank you so much, Dr. Lee. Now, according to WHO guidelines in 2010, quoted by Dr. Lee, an adult aged between 18 and 64 years should perform at least 150 minutes per week of moderate intensity aerobic physical activity or 75 minutes per week of vigorous intensity aerobics or an equivalent combination of moderate and vigorous intensity physical activity. Point to note.